Good morning, everybody. Let's get ready to go here. I know several of the press corps are on a time crunch because of the governor's weekly availability at 11 o'clock, so let's go ahead and get started, and we'll try to keep you all on time. My name is Senator Alex Padilla from the 20th District, and I want to welcome all of you to today's press conference. I'm joined by none other than the Senate President Pro Tem, Senator Darrell Steinberg, who's hiding behind me here. And is a wonderful partner in this package of bills. We'll be hearing from him as well as from Charlie Smith, the chair of the board for the American Cancer Society of California. We'll be hearing from Tricia Murakawa, who chairs the board of the American Lung Association of California. A special guest we have with us is Michelle Lemus, a senior at El Dorado High School. Yes, we have her parents' permission for her to be at a school right now. But has been very active as a youth advocate for many years when it comes to tobacco policy. And we have with us Dr. John Schaefer, a neurologist and past chair of the American Heart Association Western States Affiliate Board. And we'll have time for Q&A at the end of our remarks. But let me begin just by recognizing, for me personally, a milestone this year. This summer marks my 10th year in elected office. Patrick McGreevy from the Times, who just walked in, remembers my first election to the city council, and he's one of my witnesses in the fact that I've worked on a whole lot of issues over the years, and there's been only a very few constants. The enforcement of tobacco laws, particularly when it comes to the illegal sales of tobacco products to minors, has been one of my constants. I've consistently focused in this issue area. And I've worked over the years on various tobacco control measures with the steadfast partnership and support from organizations like the Cancer Society, like the Lung Association and the Heart Association. And these organizations are tireless in their advocacy and I think bring the best of democracy to city halls throughout the state and to this state capitol. This year, I'll continue to work with them and new partners like the Lung Cancer Alliance and the Bonnie Adario Foundation to win support for the four bills that we're presenting here today. The first bill is SB 600. It is a bill that would raise the tobacco tax in California by $1.50. And the last 10 years, as I mentioned, I've been in office for about 10 years. The last 10 years, we've seen 44 other states in America raise their tobacco tax a total of 89 times. Meanwhile, California has remained static. And as the first chart to my right and your left will show, California now ranks 31st in the country in our level of tobacco tax. This $1.50 increase will not put us at the top, but will put us in the top 5. The revenue from this tobacco tax will be dedicated to tobacco cessation and control efforts, to lung cancer research, to the enforcement of our tobacco laws, and will also generate funding for the investment of our public health in our state. In addition to the tax, there's 3 other bills, SB 601, 602, and 603, which collectively take a comprehensive step to enforce the laws and reduce youth access to tobacco in this state. SB 601 specifically would prohibit the sale of tobacco within 1,000 feet of schools. It would also prohibit the tobacco sales at non-traditional retailers. What we've seen in recent years is more and more will be categorized as non-traditional retailers selling tobacco products. I think most people are familiar with tobacco products being sold at convenience stores, at gas stations, at supermarkets, but more and more we see inspectors and advocates finding tobacco being sold in donut shops, in video stores, in nail salons, places where not only common sense doesn't lead us to believe tobacco is being sold there, but retail establishments where it's not uncommon to find young people unaccompanied by an adult shopping. Studies by the city attorney in Los Angeles have shown us over the years that the closer a retailer is to a school, the higher the violation rate is to occur when it comes to vendors selling to minors. Therefore, the 1,000-foot rule from schools makes sense to us. Non-traditional retailers, again, are not only less likely to be thought about by the folks who enforce the laws, but in practice have also shown a lesser likelihood to be inspected, and I'll repeat, a higher violation rate of the Stake Act. And last but not least, from a policy perspective, we know that 3 out of 4 smokers started smoking before the age of 18. Without getting into the health consequences of that over time, clearly there's much more we need to do to keep tobacco away from kids in California. SB 601 will do that. SB 602 would make undue concentration of tobacco retailers in a geographic area a basis for license denial. You know, we have this common sense threshold when it comes to alcohol. If there's too many alcohol retailers in a certain small geographic area, we use that as a basis to say, you know what, no, we don't need yet another alcohol retailer in this county, in this census tract, in this community. But such a structure doesn't exist when it comes to tobacco. SB 602 would establish that and go further. Currently in law, we have some fines in place for people who violate the Stake Act and are caught selling tobacco to minors. After you're caught the first time, there's somewhat of a fine. After the second time, somewhat of a bigger fine. After the third time, it's even a little bit bigger of a fine. But to see the violation rate that remains in California, we know that the fines aren't enough. So this bill will move us beyond token fines for a violation of tobacco sales laws, and actually for the first time put the suspension of a license in play for regulators. And for true repeat offenders, they would also now risk revocation of their license to sell tobacco. That raises the bar of accountability. SB 603 would, for the first time in California, cap the number of new tobacco licenses issued by the Board of Equalization in any given year. Right now, any retailer who wants to sell tobacco products sends their $100 one-time fee, I'll get to that in a second, and their simple application, and they're allowed to sell tobacco with really no new limit. SB 603 would cap the number of new licenses the Board of Equalization would grant and establish an annual license fee that would then be used to enforce the law. So it's no longer a one-time fee, but an annual fee. A fee that would be used, that the revenues would then be used specifically to enforce the law. So the combination of these bills, we believe, will go a long, long way in ensuring that tobacco is not unlawfully sold to our kids, and we will all, over time, benefit from the health, improved health across California from that. As I mentioned, I'm joined in full partnership by my colleague and the President Pro Tem of the Senate. Let me ask Senator Darrell Steinberg to come forward and say a few words.
Thank you very much, Senator Padilla, for your leadership and for your unfailing commitment to stand up for the health of Californians, especially children. I'm proud to join you in co-authoring each of these bills for 2 reasons. First of all, in this continuing time of economic uncertainty and recession, the idea that the state could generate an additional $1.2 billion a year to help protect the social safety net and the publicly funded children's health programs is something that we can't ignore. But secondly, even if there wasn't a dime to be had as a result of raising the tobacco tax, the fact that a $1.50 increase would result in a 21.6% decline in youth smoking is reason enough. think about the thousands of young people who begin smoking, who over the course of their lifetimes will automatically reduce their lifespan by years and years, who will be impacted by a myriad of health conditions throughout their lifetimes, who will cost the private and public health care systems billions of dollars as a result of starting this habit. 21.6% decline. That's reason enough to support this very, very important package, and I'm proud to stand with you. Thank you.
Our next speaker is the board chair of the American Cancer Society of California. Please welcome Charlie Smith.
Thank you.
And a constituent, by the way.
Thank you very much for that. My name is Charlie Smith. I'm the board chair of the American Cancer Society California Division. And on behalf of the American Cancer Society, I really want to say thank you to Senators Padilla and Steinberg for your leadership in this life-saving effort, because that's what really this is all about. This is about saving lives. Smoking remains the single largest preventable cause of death in California. And smoking is also the single largest cause of cancer death in California. Raising the tobacco tax has proven over and over again to drive down smoking rates, especially among youth. And the bill will also have the benefit of reducing medical costs and help plug our deficit. An increase in California is long overdue. 44 other states have raised their tax a total of 90 times since the last time we raised our tax in California. And these other raises have been done with Republican majority legislators, with Democratic majority legislators, with Republican governors, and with Democratic governors. SB 600 will be particularly effective because not only does the tax increase provide a deterrent to purchasing the product, but the measure also directs a small portion of the state's proceeds to a successful tobacco prevention program. This program in the past has helped drive down smoking rates and health costs in California and served as a model for tobacco prevention throughout the country and throughout the world. But now it is only funded 17% of the level recommended by the CDC. By some measures, we've gone from an A grade to a D grade in tobacco control funding. It's time to make California a leader again in tobacco control. Passage of SB 600 will be the top legislative priority for the American Cancer Society in California. We will look forward to working with Senators Padilla and Steinberg and our allies with us today on a major grassroots effort throughout the state to mobilize support for passage of this life-saving legislation. Thank you.
Thank you, Charlie. Our next speaker is Tricia Murakawa, board chair of the American Lung Association of California.
Good morning. My name is Tricia Murakawa, and I am the chair of the American Lung Association in California. The American Lung Association is also pleased to support this important package of legislation that will reduce the impact of tobacco on the people of our state and, more importantly, reduce youth smoking. We are very, very thankful to Senators Steinberg and Padilla, and we're pleased to join with our partners, American Cancer Society and the American Heart Association. There are still 4 million people in our state who smoke, and they need our help to stop. And too many children are starting to smoke every day. Just consider that in our state, 36,600 children under the age of 18 become new daily smokers each year. These same children buy or smoke more than 78 million packs of cigarettes each year. 14.6% or more than 275,000 high school students smoke, and cigarette companies spend $13.1 billion marketing their products to us, these deadly products to us each year. About 10% of that marketing budget, $1.3 billion, is spent in California, And who are they trying to reach? They're trying to reach our children because they need new smokers. The American Lung Association is pleased to support Senate Bill 600 to address youth smoking. Michelle will talk to you a little bit about how she has been involved in youth prevention smoking. As Charlie mentioned, the American Lung Association State of Tobacco Control Report gave California a grade of a D for our cigarette tax rate and an F for tobacco prevention and tobacco control funding. Increasing the tax and price of cigarettes and investing in prevention is one of the most single effective strategies to reducing teen smoking and preventing thousands of children from starting to smoke. In addition to the impact of the tax itself, this measure will invest in California's landmark and effective tobacco prevention programs, which have reduced tobacco consumption by 61% since 1989 and driven down smoking below nearly every other state in the nation. Thank you very much, and thank you again to the senators for your leadership.
Thank you, Tricia. Our next speaker is a senior at El Dorado High School and has been active with these efforts. And if she has it her way, she'll be the next governor of the state of California, or if not, a future governor of the state of California. Please welcome Michelle Lemus.
Hi, my name is Michelle Lemus, and I'm a senior at El Dorado High School in Placerville. I'm currently serving as an intern at the El Dorado County Public Health Department, where I work with the Youth Coalition YACSO, which stands for Youth and Adults Kicking Smoking Out. I'm here today because I believe that the state of California needs to do more to help prevent teens, like me and my peers, from starting to smoke. I have never been a fan of smoking or felt that it was anywhere near the right thing to do in any circumstance. Obviously, smoking is bad, and it causes all kinds of health problems and, of course, death. But I feel that the youth smoking has become out of control and is getting worse every year. At my school, it seems like half of the kids are always smoking, and if they're not lighting up, they're talking about it all the time. I know a few close friends that smoke, and it really bothers me because they think that it's cool or that it relaxes them. What they don't realize is that smoking just makes them look stupid. They're doing exactly what the tobacco companies want them to think about smoking, that smoking is cool and sophisticated. Well, it's just a lie. Tobacco companies are targeting them with messages and images that make them think that they're some kind of rebel if they smoke. They may be rebellious, but eventually they'll become an addict and lose control. I believe that most of my peers in high school think that when it comes to smoking, they're in the mode of, it couldn't happen to me. Many of the people I know in my high school think that they'll never become smokers, and I hope that's true. But some of them, even when they know how bad tobacco is, still smoke. I hope that the state can help these students by making cigarettes more expensive and harder to buy. Doing so will help save some lives and the future leaders of the state. Thank you.
She's got my vote. Our next speaker is Dr. John Schaefer, past chair of the American Heart Association for the Western States.
Thank you. My name is Dr. John Schaefer. I'm a neurologist, and I've been in practice in the Sacramento area for many years. I've also been a volunteer for the American Heart Association and American Stroke Association for more than 25 years. And on behalf of the American Heart Association and the American Stroke Association, I want to thank Senator Padilla and Pro Tem Steinberg for their leadership in this particular issue. Heart attack is the #1 cause of death in this country. Stroke is the #3 cause of death. Heart attack and stroke both result from narrow blood vessels, in the heart in the case of a heart attack and the brain in the case of stroke. And when you put heart attack and stroke together, they account for almost half of all deaths, which is a staggering figure. What that means is that of those listening to me right now, probably someone in your family has had a heart attack or stroke, or at least someone very close to you has suffered from a heart attack and stroke. Tobacco is a major cause for both heart attack and stroke, and it's the #1 preventable cause. Heart attacks and strokes increase with age, and while there are other factors that put people at risk, tobacco is a major preventable one, and is especially important when we see people in younger years, in their 40s and 50s, who have heart attack and stroke. In fact, just a matter of days ago, I saw a woman in her early 50s in my office who had had a stroke 2 years earlier that left her with weakness on one side of her body. And I was very struck when she told me that the doctors who took care of her in the hospital for her stroke 2 years earlier couldn't find a cause. And I pointed out to her that you smoke cigarettes, and that is a cause of stroke, that implying that you may very well have not had the stroke if you weren't a smoker. And she was surprised, and a light went on. But over and over, as a neurologist, I see this when I'm looking at studies of carotid arteries or angiograms of people's brains, where you see very narrow arteries, a very high chance that that these individuals are smokers. Not only does tobacco use cause this great personal toll to us, but there's a great financial burden as well. It's estimated that when you consider lost wages and costs of acute care and costs of taking care of people who are victims of these things, that tobacco-related diseases cost as much as $8 billion a year in the state of California. Passage of the $1.50 tobacco tax will result in 5-year health savings of $65.1 million just because of fewer people who will smoke, and therefore fewer people who will have heart attacks and strokes. Increasing California's cigarette excise tax and allocating the money to tobacco control and prevention programs is a sound investment and will save lives. We can't afford not to do it. Thank you.
Thank you, Doctor. And actually, before opening up to questions, I saw earlier some media outlets here in Spanish. Are they still here? They were stepping outside. Okay, then we'll talk to them after. They could have got it from the podium, but they couldn't wait. So now let's open it to questions, if there are any.
Senator Padilla, the idea of raising taxes on tobacco is nothing new in California. It's been tried several times, as you know, by initiative at the ballot and failed every time. So by moving these measures forward, are you not defying the will of the people?
No, actually, the last time the measure was on the ballot, yes, it lost, but it was a very, very narrow loss. I do believe that people are more and more aware as time goes on about the need, not just to raise the tax on tobacco, but to invest in the programs we've laid out today. Yes.
My name is Gloria Hovde. I'm a California co-chair for the Lung Cancer Alliance, and we are pleased to support this much-needed legislation. SB 600 provides critical funding for lung cancer research, which is the #1 cancer killer in California. So thank you very much, Senator Padilla, Senator Steinberg, and we look forward to this bill becoming law.
Thank you. Thank you. Yes.
I have a question. If we pass this tax or taxes that you're talking about, where will we move up to? Any anticipation of where we'll be on this list?
Well, currently the level is 87 cents, so adding $1.50 would put us at $2.33. We'd rank 5th.
Fifth. And what is the tax currently?
87 cents.
If smoking rates are cut and then the revenue comes down over time, does that impact any of the things you're trying to do with the new revenue?
You know what? That would be a great problem to have. We look forward to it. Yes. Not yet. We're working on it.
Talk a little bit about the difficulty of getting this enacted, signed by the governor, and also talk about the breakdown of how the money would be allocated for the general fund versus health programs. So I didn't see any details on that here.
Right. Well, the first part of your question again, the
Just
enactment.
The political difficulty of getting this enacted. Obviously, Republicans are not going to be gung-ho about signing on to a new tax increase on the heels of the budget.
Right.
Can you talk a little bit about the political prospects of this?
You know, I see the glass as half full. I'm not claiming it's going to be easy, but the budget that Senator Steinberg was able to negotiate this last round shows that where there's a will, there's a way. And we're going to appeal to our colleagues that not only do we need their will, but that this is just fundamentally the right thing to do.
And the breakdown of the
Do we have
where the revenue
specific
goes?
breakdowns?
It's 85% general fund and 15% tobacco prevention.
Want to come up here and lay it out for me?
Yes. Paul Neprath, American Lung Association. The bill specifies 85% of the revenues would be directed to the general fund and 15% would be directed to the state's tobacco prevention control programs and lung cancer research.
Is this a two-thirds measure?
It is.
Where are these bills at currently? What's the process? Where are we at in getting this introduced?
Well, the bills were introduced prior to the deadline of a couple of Fridays ago, and so they're in that 30-day waiting period before being heard in committee. And they might actually each they're not all going to take the same route, given the specific content of the bill, the tax measure versus some of the licensing issues versus those sorts of things.
I know you answered this in part before, but with the tobacco cessation programs proving effective, the number of smokers over time diminishing, wouldn't you have diminishing revenue if this is successful, and how would that affect your...
Yes, on the one hand, we look forward to diminishing revenue if we're successful in reducing the smoking rate in California, particularly when it comes to kids. But we'd also see a parallel reduction in costs, in healthcare costs that are necessary to take care of the health consequences of smoking, and we see a parallel increase in productivity in the workplace with less people being out sick.
Senator, each of these bills stand or fall on their own. Will you proceed with each?
Yes,
regardless of whether the tax increase was listed with a piece of the package?
Yeah, that's why it's a package of 4 bills.
Senator Steinberg, this one might be best for you. Would this indicate that the Senate has no interest in pursuing Assemblyman Amiano's proposal to regulate and tax marijuana?
I appreciate any new ideas that seek to help protect funding for needed public services, but I would prefer the tobacco tax than Assemblymember Amiano's proposal. I think it's interesting, but I'm not quite there.
Just because it's been asked a couple of times, the chances of getting a tax approved by this legislature, more specifically convincing some of our Republican colleagues to support it. Let me just say again, I threw out the numbers earlier, about 44 other states having increased taxes in the last 10 years, a total of 89 times. 39 of those tobacco taxes have been signed by Republican governors throughout the country since 2002. So that's just in the last six and a half year time window, including Alaska. So we'll be appealing to our colleagues. Any other questions? If not, thank you for being here. We'll see you in committee.